don't understand why they're using Signal. I know that it's more secure than a lot of other applications, but surely government has more secure channels than freaking Signal. This story obviously has the slimmest of connections to healthcare, other than the fact that I'm guessing national security officials, when they read the news on Atlantic, went into mental crisis mode. Hinge Health came out and provided their S1 filing. What stood out to you in the S1 document?
Revenues are up like, I don't know, 33% from 2023 to 2024. I mean, $390 million in revenue. Woohoo!
We don't have a complete picture of what our costs are related to hospital expenses because Anthem Blue Cross will not share data with us. Hello and welcome to Debunked, where we take a no-fluff approach to analyzing healthcare news and debunk some myths from time to time. Samir, where do we begin? Completely unrelated to healthcare, but as a follower of news and a warrior of national security, I was appalled by the story that I think all of us were appalled by, which is this news that the editor of Atlantic magazine got pulled accidentally into a private Signal chat group full of Trump administration officials, and they were texting back and forth and war, targets and operations against Houthis, the rebels in Yemen that have disrupted global trade, by attacking US and European ships. And I'm thinking, Signal? Really? I thought they were just mainly used by journalists. But wow, I mean, every time I think I want to give this administration the benefit of the doubt, I think me and other people are, broadly interested in making government more efficient, but more and more, nothing concrete is coming out. I mean, you really don't have evidence of massive fraud in Social Security, for example. There's sheer chaos of government function, not government function, but government dysfunction, because they're laying off workers and then realizing, oh, we let go of Ebola experts. We need to hire them back. And then this takes the cake. I mean, you can't make this up. I mean, I just don't know what to say anymore.
Are you seriously surprised? I'm not. But honestly, I mean, now we're going to have to worry about confidential communication protocols amongst the government officials themselves.
I mean, I don't understand why they're using Signal. I know that it's more secure than a lot of other applications, but surely government has more secure channels than freaking Signal. Anyway, this story obviously has the slimmest of connections to healthcare, other than the fact that I'm guessing national security officials, when they read the news on Atlantic, went into mental crisis mode,
Listen, I'm sure some of them are hoping that they have early onset of dementia.
Oh my God.
Oh, I'm so sorry that I even said that. That's really bad that I'm saying that, right? But I mean, it's true, right? Like, wait, what did I say? Look, maybe I'm having it now. Like, I don't know. I forgot.
I'm going to take inspiration from our current president and give you a nickname like Wisecrackin' Samir.
There you go.
Oh my God. Okay, now, seriously. To healthcare news. Last month in our episode, we speculated on certain companies that might want to go public either this year or in 2026. And we didn't have to wait long, right?
No.
Hinge Health came out, and Hinge Health was one of the companies that we speculated about. Hinge Health came out and provided their S1 filing. They're the brave souls going out, going public at this time. What stood out to you in the S1 document?
Look, first of all, yes. IPO, baby, right?
Yep.
I mean, this is great. I'm really excited. Can you tell that I'm really excited?
I can tell, yeah.
Okay. Look, we haven't had anything since Waystar last year, right? So it's been a long time. Look, all us investors, VCs, are really interested and at the same time concerned about digital health and how the market is going to treat our investments, right? It has not been kind because, let's just be honest, a bunch of these fools messed shit up. They just did, right? Like, they really did not do it right, and the market didn't treat them right. So there's like this negative connotation about digital health, healthcare companies, whatever you want to call it. And look, the thing that's really interesting to me is the timing. I mean, the market is taking like a huge dump,
Oh,
right? Just over and over again. I mean, that kind of connects to the sentiment that you were talking about with the administration and stuff. The market's not playing out really nicely. I think independent of that, I think Hinge and Sword and all these companies, I mean, we talked about this last time. This was their path no matter what.
True.
Right? As the interest rates started curbing and inflation started coming down, these companies were basically preparing themselves for this to happen. Look, typically what happens is when a company is getting ready for IPO, they start cleaning up their books, right? Start strengthening their books, they start cleaning them up, lowering cost, because you really want to focus on your EBITDA and your revenue growth and your margins. These are like the three things that everybody's got to focus on. So first of all, let's back up. Like, what does Hinge actually do, right? They're providing virtual PT, right? And their main market and focus has been self-insured. And obviously virtual PT to avoid costly surgeries. And I know you're going to talk about some of the, results or benefits of that stuff.
Right.
Now, revenues are up like, I don't know, 33% from 2023 to 2024. I mean, $390 million in revenue, woohoo, right? Margins at 77%, woohoo. By the way, I was born in 77. I like that number, it's like, it sounds good to me, right? All right, now what are their future plans? Because that's the other important thing that's going to happen is like, okay, you're going public, you got strong financials, fundamentals, great. The problem has been that all these companies have gone public have taken a massive shit again after they went public. And then we've had public-private buyouts and all this sort of crap happening.
yeah.
And we've also seen that one-trick ponies don't last too long, right? We're going to talk about that again in a little bit, right? So what is Hinge going to do? You're milking the self-insured employer market. You have probably milked it as much as you could have milked it.
Yeah.
They talk about going into Medicare and talk about going into traditional insured markets. Well, curb your enthusiasm, right? Because the sales cycle for those is much longer because now you're dealing with payers.
Right.
And they're going to take a much longer time. And Medicare, we don't even know what's going to happen with Medicare, right? Who knows? Maybe in 6 months we might not even have Medicare.
No,
I don't know.
Okay, that's going overboard. Come on, man.
Come on, I'm just going to pull that
Trump
string.
is gonna lose. He knows. He has said he's not touching Medicare. No.
No. I keep forgetting. He's going to make America great again.
No, he's going to cut Medicaid, is what he said.
Medicaid.
Yes.
Look, knowing him, that dude is not going to take his medicine properly, and he's going to cut Medicare instead of Medicaid. I mean, look at that.
Oh, no,
they cut Ebola.
For defamation here,
they cut Ebola, and then we forgot. It's Ebola. Maybe there was like some missing in translation, something like that happened. Anyways, my point is
yes.
My point with Hinge is that so you're going to have there's two ways to do this, right? Either you stay in self-insured because it's the it's the market that right? Or you have to step out into another market. So we talked about going into another market using your same product. Your sales cycle is going to be longer,
right?
Which means most likely your margins are going to drop. That's not good for the future of your business. So then if you stay in self-insured, what do you got to do? Well, you got to get away from being a point solution. And so you're going to have to buy other shit.
Yeah.
Right? You're going to have to buy other stuff. Maybe you're doing virtual delivery of whatever. Maybe you go to businesses that are sort of slightly next to you.
Yeah.
Or do you go buy diabetes care management or whatever the heck it is?
Yeah.
But something's going to have to give, and we don't know what that give is.
Yeah.
But it's going to have to happen if Hinge is going to survive as Hinge. It's not going to last. I'm just being honest.
Yeah.
If they just keep doing what they're doing, they've probably milked a lot of the market that they were going to milk. And that market itself has competition. I mean, Sword is right behind them. Vori just raised a bunch of money. They're right behind them.
Okay.
So you're not going to be able to sustain that. You're going to have to grow, right? Companies go public. It's not like, oh, I've arrived, let's have the yacht party, it's over. No, you got to keep rowing.
Yes.
You got to keep surviving on the water.
Sure.
How are you going to do that?
Well, I mean, to me, what's interesting is that MSK is a large addressable market, right? It is the second most expensive condition to treat after cancer.
Yeah.
So it's a huge market. So I think that's a benefit for them. The other thing that I liked in the S1 is that it is actually trending towards profitability. I know as investors you go bonkers over revenue growth, but
no, I love profitability. Don't get me wrong.
We poor journalists, we try to stick to the actual money making that's happening. So they actually narrowed their loss tremendously. They had 108.1 million loss in 2023. In 2024, it was like 11.9 million. So
it's like a rounding error.
For
a company that size,
I will say they massively shrunk their losses, which is worth cheering.
But to the point, that's what companies have to do and need to do when they're about to go public.
Absolutely.
Right, so.
And then I just wanted to read some bits about their value. You know, they talk about value. So they say that their platform is supported by results from 19 studies that they did. So one such study was the 2023 employer claim study. And they're saying that they have estimated an ROI of 2.4 times for clients included in the study based on their estimated 2,387 average cost savings per member over a 12-month period of time, divided by obviously the cost of the chronic program. So that was nice. They're talking about ROI. And then they did a second study. They referred to a second study, the 2020 longitudinal study. And over there they said that participants with chronic knee and back pain, they reported an average improvement of 68% in terms of lower pain and 58% reduction in reported depression and anxiety after just 12 weeks. So I think those things, the outcomes are good, the trending towards profitability to it, and something that was like sweet music to me. I did this just for kicks. I went in and did a Control F search for the term ROI.
Yes.
And how many times did ROI be used in the S1? So I looked at some comparisons.
Tell us.
ROI was mentioned 24 times in the S1 of Hinge.
Okay.
For Waystar, it was 6 times. Doximity had it 15 times. Livongo, back in the day, had it 9 times. And Castlight Health had it exactly 0 times.
So where is Castlight now?
They were taken private.
Where's Livongo now?
Part of Teladoc and not doing so well.
And then written off.
Remember, Livongo people like to say that Teladoc messed it up. I don't know. The truth probably lies somewhere in the middle. But anyway, it's a factoid how many times ROI was used, and I don't know in what context. I just counted the number of times. But as a journalist, it seems nice to see and hear the word used in an S1 multiple times.
I totally 100% agree. We should be talking about ROI. I mean, how shocking are you? You're going to go public. We should talk about ROI?
Yes.
Oh, no shit.
Yes.
Maybe we should.
Yes. On that happy note, we'll pause here to listen to a message from our sponsor, Veradigm.
This episode of Debunked is brought to you by Veradigm. Some healthcare technology companies deliver clinical data for biopharma and health plans. Some help turn that data into insights, and others serve healthcare providers directly by providing point-of-care clinical software. Only Veradigm does it all. That unique combination, added to our nationwide scale, is why so many leading healthcare companies choose to be a part of the Veradigm network, working together with Veradigm to transform healthcare insightfully. Whether you're a healthcare provider, patient, biopharma company, or payer, check out www.veradigm.com. That's www.veradigm.com to learn how Veradigm can help you too.
We're back. Thank you, Veradigm, for supporting us. Samir, one other interesting piece of news that I came across scouring as I normally am for our Debunked show. Because I just don't like to talk about what we report on MedCity News. There's lots of fun stuff happening. So this one, obviously, we hadn't reported on.
Yeah.
This is the New York City.
Yeah.
They have a new Office of Healthcare Accountability. And they published a report on how much their expenses are on hospital-related costs. And they were getting their data from their insurer, which is Anthem Blue Cross. And in the report, there's a bunch of data. I won't go into that. But the most interesting bit was, they're like, you know what? We don't have a complete picture of what our costs are related to hospital expenses because Anthem Blue Cross will not share data with us. And I'm thinking, okay, how much does Anthem get paid by the city of New York? Apparently, again, this is according to news reports. We haven't done this reporting ourselves. According to news reports, the 900,000 employees of the city of New York To cover them, the city pays Anthem Blue Cross $3 billion. Now that's a pretty penny. I would pony up, if my customer wants the data. But you know what the defense is? You gotta listen to the defense. So the defense from Anthem Blue Cross is, well, we can't share complete data because we have some confidentiality agreements with our local hospitals that predate the federal rule on pricing transparency. I mean, can you say lame?
Well, first of all, I want to say, and I want to clear the air, I love Anthem Blue Cross. Okay, I love you guys. Okay, my insurance is with them. I kind of have to say it. Okay, no. I'm serious. What is your defense here? Like literally, oh, you know what? We have this agreement that we can't reveal confidential information.
Yeah.
But I mean, this is literally, you know what this reminds me of? It reminds me of when I was younger and I used to sit there and say, hey, you know what? I did my homework, but the dog ate it. I mean, what do you want me to do? Like, the dog ate my homework, so I can't show it to you. You know what I mean? Like, it's in his stomach, but I really did do it. You got to trust me.
Yeah.
Right? So here, I'm going to show you the $3 billion, but like, I'm not going to share with you the detail. But you got to believe me because the dog ate my homework. I mean, this is exactly the same thing. But here's what I love about it. Even when they dug deeper, right? Like, trust me, I'm not screwing you, New York City, right?
Yeah.
But when they actually dug deeper and they started sort of demanding full transparency, even with some of the analysis that they did you see the analysis that they did?
Okay, which day? You're talking about Anthem Blue Cross?
No, the city, the office, right?
Okay.
When they did some analysis.
Of the data.
Paralysis analysis, right?
Okay.
Basically. I mean, did you see the number on the colonoscopy? Oh my God, it kind of scared me. Colonoscopy cost ranged from $940 to $12,000.
$940.
$940 to $12,000. Ouch. That hurts. The pun is definitely intended there.
Oh my God, Samir.
But that is a huge variance.
Yeah, it is a huge variance. Yeah, no question. But you know what? I don't want to put Anthem Blue Cross on the spot because this is actually not an uncommon practice. If you look at, even in the world of employer, non-public insurance, we've been hearing this more and more. A couple of years ago, I think, one of our reporters wrote a story on Kraft Heinz suing Aetna because they were not getting full data on their medical claims.
Yeah.
And sometimes employees are suing employers saying, you know what? You're overpaying for prescribed, prescription medication, and you're not doing your fiduciary duty by us, and we have to pay all this amount. And it's a problem. It's not new. It's a problem.
It's definitely a problem. And here's the thing that was also in the article that you sent. The contract is coming up for renewal. So New York City can technically just put it out to bid again.
I don't know. I think it's hard to make these huge structural adjustments. Change is not easy, and government change is hard, as we can see.
This is just bully tactics, man.
We'll see what happens. But finally, the last piece of news that we're going to discuss is the sad demise of 23andMe. Anne Wojcicki valiantly tried to salvage her company.
Yeah.
She had initially wanted to take it private. There was a mass exodus of the independent board members in September. And then she tried to get some capital together. She had pretty much gotten it lined up to take the company public. I'm sorry, take her company private. I keep doing that. Take the company private, but financing fell through. I think New Mountain Capital backed out, and then she was going to do it all by herself. And then I think the minority shareholders said, no, this is not such a great idea. So right now, it's in bankruptcy court proceedings, and she has resigned. And I'm like, it was a storied pioneering company. How did it become like this? I mean, was the test just commoditized? But then they also had a biopharma arm. So I just don't know. What do you think, Samir?
I mean, what we've already covered this in the past, and the writing has clearly been on the wall. Did you need a DNA test to figure that one out? No, but honestly, it again points to, I'm going to back up here for a second. I love the Hinge story, right? Okay,
yeah.
Look, and I love, as an investor in digital health, I want success, I want all these things to go well. But look, the market is really difficult and it's going to punish you if you do not keep evolving your product suite. If you are a one-trick pony where you lose your competitive edge, it is not going to treat you nicely.
And that's what happened to 23andMe.
I mean, if you think about it, right? Like now it's a commodity.
Yeah.
Ancestry, look at Ancestry DNA. They're also gone private. They're not like, do you see ads anymore for either one of companies on TV anymore?
No.
It's been commoditized. Look, there was an opportunity for you to take this brand. You had the world at your fingertips. You were the first major platform. I mean, as a founder CEO, you were enigmatic. You ended up on Shark Tank. Like you were like, you were a household name.
Exactly.
You got complacent because look, this became a thing, right? Now look at how many lab developed tests there are for at home. But now we do everything from allergies to like biomarkers for like everything.
Yeah.
If you'd established yourself as a platform and moved into that arena and basically said, we are going to be the brand name for testing at home.
Right.
No, you bought Lemonade or Limeade or whatever the heck it was and like said, I'm going to do, I know, I'm just kidding. You decided to go become virtual care because everybody's doing virtual care. Yeah, let me go do what everybody else is doing too. So I think, look, look, again, it's hindsight is 2020, right?
True.
I'm sitting here on top of my big mountain and sitting there screaming, oh yeah, you screwed up.
Yeah.
It's hard to say that.
Yeah.
But it's true. Like if you're a one-trick pony and your defensibility erodes and market catches up to you, you're not going to survive unless you do something for your business.
I mean, I hear what you're saying, but I still, looking back, I still see, they started doing the test, FDA got mad at them. They still went through the rigor of making it an FDA test. So they did have challenges that they overcame. It's just maybe you're right. Maybe the vision wasn't broad enough and it was like virtual care is just, another commodity that they
it has become a complete commodity, right?
Yeah.
The fact of the matter is, look, this is not me saying it.
Yeah.
This is the market. This is the public perception and market saying that if you are a one product company and you don't evolve with competition or the times, you are gonna get killed.
There
like it's
go.
Not me.
Yeah.
Like, can we go back? Like Kodak, Walgreens, like these are massive companies that don't exist anymore.
Yeah.
Because they didn't evolve. Blockbuster, like all these companies.
Walgreens exists. It's just.
But you know what I'm trying to
equity.
say. But I mean, all these things. Like, look, everybody was
Circuit City.
Circuit City, Blockbuster, all these companies. What happened? What happened?
Yeah.
Technology came. You didn't involve.
Yeah.
You went away.
So the lesson of today's episode is change is the only constant. On that note, please write to us at debunked@medcitynews.com. You can find me on Signal and you can find Samir at conferences. So please write to us and keep watching. Thank you.
And remember, I love Anthem Blue Cross. Okay, I love you guys. Thanks.